Welcome back to West Texas View.
Before the break, we were talking with Dr. Chupp about adolescence and the particular problems and situations having to do with being an adolescent. And it's kind of a catchment area between pediatrics and young adulthood that really needs its own specialty. So we now have that in the Texas Tech University Health Science Center Laura Bush Institute. So Dr. Chupp, talk to us a little bit about some of the special problems that adolescents face.
Okay, sure. You know, as we kind of talked about before the commercial break, girls here, I'm a gynecologist, boys and girls actually have similar medical predispositions, but because I do gynecology, I have a special interest in the female population. One of the big things, again, that we see is diabetes and pre-diabetes, even at an early age now, because of the obesity epidemic. So there's probably a 15 to 16% rate in this West Texas area of pre-diabetes in adolescents, which is a lot more than it used to be. Also, we have a high teen pregnancy rate, higher again than even the Texas average, and Texas is already higher than the national average. So that's a medical issue. There are other components, but it's also medical. You know, if a teen gets pregnant, they're less likely to finish high school, go to college. It's, you know, they become, a lot of times, their children become incarcerated because they don't have the community support that they need, or the means that they need. So it's a medical...
And they don't have a way to climb out of it.
Yes, and so sometimes just a small ounce of prevention, you know, is a great thing. We also have a high sexually transmitted disease rate here, but not particularly higher than other counties, but high. Across the U.S. it's high. We have high rates of alcoholism, depression, and suicide in adults and in teens, and that's also true throughout the U.S. It's not particularly specific to West Texas, but it's an issue. There are things you can do in the adolescent years which will prevent cancer in the adult years. And some things that everybody knows about are things like sunscreen. You know, we have harsh sun exposure here. We have a full-time dermatologist now that only treats skin cancers. That's how many skin cancers we have just in this area. But there are things you can do to prevent that, obviously. If you learn about these when you're young, you know, it really translates to lower cancer rates when you're older. The other thing you can do when you're a teen is you can prevent things like stroke and heart attack by lowering your risk of diabetes. Stroke and heart attack are associated with diabetes. So if you can stamp that out early, you can stamp those problems out later.
And start life-changing habits.
Yes, and things like alcoholism, tobacco use start in the teen years. And we know that the rates of teenagers that try alcohol and tobacco are close to 50% in some counties. We have data from the Texas Department of Health. They track this. They do phone surveys. You know, they randomly do phone surveys, and they track county data, and our region has 50% alcohol use by 18 years old. At least they've tried alcohol once. Doesn't mean they're drinking every day, but again, education and trying to prevent these things. You know, why not try to prevent some of those things? If girls take oral contraceptives or birth control pills or any other form of contraception that's hormonal, if they're having problems, they miss less days of school because they're not having pain associated with their period. They can actually prevent cancers of the uterus and cancers of the ovary later on, the longer they use these things. Of course, you always have pregnancy prevention, which is important. So there's a lot of health benefits to just educating people and making them aware, and then giving them the treatment that they need. There are medications we can give if we diagnose a patient who is going to become diabetic, who's on that path. There's a simple blood test we can do. And Midland Memorial Hospital now has a nutritional counseling center. So we can do the blood test, we can identify the patient early on. Many times they'll come in to see me because their periods are irregular, and what the real problem is they have a pre-diabetic condition that can cause the periods to be irregular. So what I can do then is plug them into the nutritional counseling, start them on some medication, either birth control pills, which actually help a lot with the period problem, and also reduce their chance of cancer of the uterus, because diabetics have a higher rate of cancer of the uterus. It's all related. So anyway, all these things this is the opportune time to intervene. And the longer they do these things and the more compliant they are, which we also have a study helping with that, you know, the less likely they are to become unhealthy adults, to be healthier as adults.
And so what I'm hearing is that there's a lot of reasons people take birth control pills.
A lot of
reasons that adolescents take birth control pills. Probably the least of which is the birth control.
Well, we have a lot of people who asked for birth control, but we have a lot of mothers who bring their daughters in because they're missing school because their periods are
too heavy.
I put a patient in the hospital a couple of weeks ago because her periods were so heavy that she was anemic to the point where she needed blood transfusion, and that she's now on a birth control pill to keep that from happening again, and it's very successful. Some teenagers come to the emergency room and they have a cyst on their ovary that's ruptured and they end up going into surgery. Birth control pills can prevent that also, and for a teenager that's had that in the past, I definitely think that's a good idea. So there's many reasons that people show up for
and
problems.
I didn't know that you took birth control pills sometimes for certain kinds of acne.
Yes, all forms of birth control pills have been shown to improve acne. So sometimes the dermatologist will send us a patient because they want to start them on a medication that's harmful if a pregnancy occurs, and they also sometimes will send us a patient so that they can start the birth control pill to help with their acne and improve that. And people who have diabetes and pre-diabetes tend to have irregular periods and acne. So again, the birth control pill can help with the pre-diabetes prevention of uterine cancer, and it also can help with the acne. So there's just a lot of things going on there that are medical.
And one other thing, when a person has hereditary genes that might cause them to be predisposed to cancer, will birth control pills help that? The predisposition?
We don't really know that.
Oh, okay.
Now, there are some genetic people who are predisposed genetically, but I will tell you, for instance, in breast cancer, only 10% of the new breast cancers are in the people who have a genetic predisposition. 90% of the new breast cancers, people have no extra risk. It's just a very common disease. So, for instance, uterine cancer, the type that is genetically predisposed is a very small proportion of all the uterine cancer. So we can't maybe fix that right now. But what we can do is fix the 90% that we know will occur if you don't change some of the habits or the medical conditions.
We're going to be back in just a minute with another part of the program.
Stay tuned. West Texas View will be right back.